Hi, Dr. Bilezikian. I'm a plastic surgeon here at Coastal Cosmetic Center. Today we're doing upper eyelid surgery. It's also called Blepharoplasty. And so right now I've had some markings that I did preoperatively, and she's asleep for this procedure. And basically what I'll be using is this kind of fancy little measuring device, little caliper, to mark out the areas where I'll be excising some skin and muscle and give her a much tighter appearance. So you can kind of see here that she has a lot of excess skin, and even though she's laying down and she's asleep, this is what we're going to aim to remove. However, this kind of is different along the length of the eye in order to have a good aesthetic appearance. And so you have to kind of measure it out and make sure that you're giving her a really good result. All right, so now we have all the markings in place, and I did some pinch tests and some measuring to get the excision I want without causing over eyelid retraction or opening, because that's a potential complication that you want to really avoid and be careful of. So right now I'm injecting some lidocaine. The lidocaine really bubbles up the area, and it also gives some analgesia, so there's less pain after the procedure. Just removing the eyelid skin here. So we took off the skin, and this layer right here now is what's called the orbicularis. It's the circular muscle around the eye that causes the eyelid to close shut. And so when you remove a lot of the skin on top of the eyelid, you want to remove a thin layer of this muscle to give it better tightness, so there's not a lot of bunching of tissue above the eye, so it has a good sleek contour when you're done. And I checked her earlier for fat by pushing down here, and it doesn't look like there's much fat bulging from this area, so we're not going to be removing any fat for her. So just finished stitching up this side. As you can see, the wound now is all closed. In the middle there's dissolvable stitches, and on the side here these will come out in clinic, and that's to prevent it opening up or when people scratch it on the side. The incision also extends on the side just into a normal smile line, and so it's essentially hidden, and the crease on the top is in the line of where the eyelid opens, so that's also hidden once it all heals up. All right, so we're all done, and you can see the sutures are in, and we're about to put the dressings on, and we'll see her in office tomorrow.